Hello everyone, my name is Allison Fleck and I am a part of the 2015 full-time MPH cohort. My practicum was completed with the BC Healthy Living Alliance, which in this presentation I will be referring to as BCHLA. And my practicum work was primarily focused on health policy advocacy relating to active transportation and public transit in British Columbia. So here's just a brief agenda describing the overview of my topics of discussion. I'm going to begin with a brief appreciation, then dive into a background on physical activity and the built environment in British Columbia. Then I'm going to talk about my culminating project, which was a communication package for the Communities on the Move Declaration, which I'll explain later. I'll then talk about the public health implications of my project and conclude by tying together how my project's going to affect the built environment and physical activity in BC. So I'd like to start with my appreciation. I'd like to extend my appreciation to those who made all these past 4 months possible for me, from BCHLA, my supervisor Rita, as well as my only two other colleagues, Brenda and Sam. They were all very supportive. From UVic, my instructors, Kathy and Sari, were very excellent instructors, and also acknowledging Betty Taylor for supporting me during my practicum search, and all my MPH colleagues for being very supportive and giving lots of good advice during my practicum. So just a brief background to start. As most of us are aware, physical activity is an effective way in preventing several chronic diseases, yet only 21% of Canadians are actually meeting the current physical activity guidelines right now. So there are a lot of ways that we can go about trying to increase physical activity in our communities, and for my practicum we decided to focus on built environment interventions. So the built environment can help create active communities and has been found to directly impact social cohesion, health, chronic disease, obesity, and injury. And there is a big need right now for built environment policies directed at creating more healthy, safe, and well-connected transportation systems in British Columbia. So Communities on the Move, as the first page is pictured here, is a declaration put forth by BCHLA that urges the provincial government to make progressive investments that support active, connected, and healthy communities. So such investments would include a provincial active transportation strategy, public transit improvements, all with a commitment to equity, safety, and regional needs. Before BCHLA wants to bring this declaration to the government, though, they wanted it to be endorsed by over 100 stakeholders. So for my culminating project, I created a communication package meant for the marketing of the Communities on the Move Declaration. So I began by analyzing the relationship between healthy transportation and some of the social determinants of health, and then I used that information to create a very informal database. I then used the database to create population-specific communication materials, and as you can see, they were social media posts, an infographic, a briefing note, a quick fact sheet, template emails, information for partners, cases of support, and a blog post. So there's a lot going on there. The package was then used to better inform stakeholders about the connection between health and transportation, and then to harness endorsements of Communities on the Move. So the purpose of my culminating project was threefold. The first was to increase health literacy in BC residents. The second was to encourage stakeholders and local governments to endorse the declaration. And the third was to increase decision makers' knowledge on Communities on the Move, and then also on the relationship between health and transportation. So the database I developed included information on the relationships between active transportation and public transit and environmental sustainability, physical health, social and mental health, the economy, and equity. So as I mentioned before, it was used as a pool of information when creating the communication material. So I'm going to give a few highlights from the database right now. I won't dive too far into it as we do not have enough time. For environmental sustainability, we found that tailpipe emissions in BC actually account for 38% of provincial greenhouse gases, and one city bus can take 40 vehicles off the road, save 70,000 liters of fuel, and keep 168 tons of pollutants out of the atmosphere each year. This is so important for our relationship with our environment, as well as air pollution for our physical health. Speaking of physical health, we know that 62% of men and 46% of women in Canada are considered overweight or obese. This risk of obesity actually increases 6% for every hour spent in a car per day and decreases 5% for every kilometer walked per day. So those who take transit have been found to be 22% less likely to be obese, and those who commute by bike or foot are 48% less likely. So there's obviously a huge connection between active transportation infrastructure and public transit and our physical health in terms of obesity, chronic disease, and physical inactivity. And in terms of physical safety, taking transit has actually been shown to be 20 times safer than being in a car for the same trip. So it also improves our short-term health. In terms of the economy, each year in BC, excess weight costs $772 million and inactivity $350 million in healthcare. So one report suggests that every dollar invested in transit yields about $3 in economic benefits. And in terms of active transportation, there are examples all over the world of how active transportation infrastructure can help improve the economy. So for example, Oregon has estimated that in 2012, cycling tourists contributed $400 million to their economy. So there's obviously a lot of potential right there. In terms of equity, we actually found that low-income individuals are 2 times more likely to lose their life when walking compared to high-income individuals. And this is because there's a greater chance of a community having safe walking opportunities if they're high income. So likewise, 14% of high-income communities have requirements for bike lanes, when only 5% of low-income communities have the same. So there's obviously a huge discrepancy there, and Communities on the Move aims to lessen this gap a little bit. And lastly, for social and mental health, using active transportation has been found to decrease the risk of developing depression, and 59% of cyclists actually report their commute as the most pleasant activity of the day, when compared to only 37% of drivers. In terms of social health, we see that walking and cycling creates that increased interaction with the environment, and that directly impacts one's sense of home, neighborhood, and belonging. So the database was then used to create the communication material. So I started by creating many social media posts, including Facebook posts, tweets, and blog posts. We did this because social media advocacy has been shown to be a successful way to reach both individuals and stakeholder groups. The posts that we created asked questions to keep users feel engaged. They used hashtags to widen the discussion. They used language that everybody could understand, and they encouraged other health-oriented NGOs to participate in the online discussion about communities on the move. Here are just a couple screenshots that I took of my blog post on the top and 2 tweets. If anybody's interested in seeing all of the tweets I created, you can definitely ask me after the presentation. I have them all on my computer. In terms of promotional materials, we found that tailored print interventions have been found to be effective for health behavior change. So I created cases of support, a quick fact sheet, and an infographic because of this relationship. I also created 3 template emails used to contact organizations, municipalities, and MLAs about communities on the move. And this is because email campaigns have been shown to be a very successful way at health advocacy. And we actually have seen the direct results of this. Our emails have created more endorsers than any other part of the communication package. So I also developed a briefing note. It hasn't been used yet, but it will eventually be used to discuss communities on the move with the new MLAs after the election in May. Briefing notes are always really important just to create condensed information for somebody who doesn't have a lot of time to discuss. So here is the infographic that we created. So this isn't actually the final version yet. I believe the graphic designer is still working on it. So I can't distribute this, but once it's done, again, if anybody wants to see it, just let me know and I can pass it along. So all of the material I created, we're hoping will be successful in increasing health literacy regarding active transportation and public transit's relationship with health in BC. So the package has actually already been used to secure 76 endorsers now since I've sent this in, including health organizations, transportation groups, municipalities, First Nation groups, businesses, disability groups, elderly populations, and student groups. So there's a huge variety, which is really awesome. With more people signing on every day, we think it might be likely that the government will invest in the strategies proposed, which would be very exciting. So this project really taught me the importance of creating communication material while trying to advocate for health policy. We think that the use of this material is important for harnessing endorsements, which show the government that these policies are wanted and needed. And so we hope that this will lead to an increase in physical activity and a decrease in chronic disease in BC because of the active transportation infrastructure and public transit improvements. Thank you very much.
Thank you, Ellie. Questions, since we're all sitting here?
Thank you very a great talk and really interesting. I'm just wondering, what are sort of the greatest barriers to, in terms of actually people getting on bikes or using public transit, in the sense that there seems to be quite a resistance?
Of course. We actually, we just got our hands on, at BCHLA, some public opinion polling, and I can't know for sure if this is the exact stat, but it was something close to 70% of people who said that they would bike if they felt it was safer. And they feel unsafe on the road. So to us, that shows that you need more separated bike paths that aren't just biking along the side of cars, like we call them bike highways, as well as safe walking opportunities, and that we find increases people's likelihood to use it.
So I presume you're very interested in the work that's done in places like Copenhagen and
well, yeah.
Amsterdam. Yeah.
Well, that's the thing, yeah. And you do hear a lot of resistance towards active transportation, especially in Vancouver, but apparently there is a great want and need for it. So,
thank you.
I would just like to offer a comment, if I may. Here in Victoria, the mayor, Lisa Helps, with council, has agreed to create what she calls Biketoria. And my wife listens to CFAX, which is a local talk radio, and it's amazing the amount of Lisa Helps bashing that occurs about taking away parking places in downtown to have dedicated bike lanes. But I was at a gathering of friends and family, and people were saying that that in 4 to 6 years, people are going to look at Lisa Helps and the council as being real heroes and sheroes for creating more biking opportunities to and from downtown Victoria. So there might
Victoria
be
is definitely a big leader.
Anybody else? Over here, just a second. It's so good to walk.
Just wondering as well, like, to think about solutions on what happens when you finish your journey with your bike, because unfortunately a lot of the bike lockers downtown aren't sufficient. But say you come to UVic, it's beautiful, you have all these spaces where you can secure your bike. So I think that's another factor where people feel like they can't properly secure spaces where they can put their bikes and they can leave it and have comfort knowing that they can go back 8 hours after a work day or after spending a day with friends, because it's obviously the city's invested quite a bit of money to what Lynn was just saying, having that designated bike lane, but there's very few bike lockers now downtown because people are cycling so much. There's no spaces to put your bike.
No, that's something we didn't really touch upon in my practicum, but I've seen from the research that one of the things that encourages people to bike to work is their works having a designated bike space. And I know quite a few businesses in downtown Vancouver that do have that kind of basement room where the employees can bring their bikes, and I think that's definitely a big encouraging factor for those people to use it, but I definitely think there needs to be more public spaces available as well.
Okay, thank you very much, Allie.
Thank you.